New hope for heart patients suffering from an irregular heartbeat called cardiac arrhythmia, or AFib. In today's Your Health Matters, you'll see how HCA Health Midwest is providing a first-of-its-kind robotic solution right here in the Midwest. A normal resting heart rate for adults ranges between 60 to 100 beats per minute. But in the United States, according to HCA Health Midwest, an estimated 2.6 to 6.1 million Americans have extremely fast, irregular heartbeats that can turn into something much worse.
It is a very complex arrhythmia that increases your propensity for congestive heart failure, stroke, dementia, and many other complications that could come from that.
Dr. DJ Laccaretti is an internationally known researcher and physician at HCA Health Midwest. He's also medical director of the new KC Heart Rhythm Institute.
People commonly complain of butterflies in their chest, right? So I think when people do have family history suggestive of atrial fibrillation, if they have high blood pressures, diabetes, they have obesity, obstructive sleep apnea, these are the ones that are at a relatively higher risk of atrial fibrillation. And when you have a fluttering heart, please make sure that you mention this to your primary care physician or your cardiologist if you have one, to make sure that they check you out for one.
New EP labs at Overland Park Regional Medical Center are armed with robotic technology, essential for helping doctors restore normal heart rhythms.
You have areas of the heart that are oftentimes difficult to reach with manual catheters. So there are the nook and cranny and the crevices inside your heart that are sometimes physically impossible to get to with the help of your hands, because you don't have that level of dexterity and skill in your own hand, which can be answered with the help of a robot.
The procedure is called radiofrequency ablation.
Imagine rapid electrical short circuiting that happens inside your upper chambers, that drives your upper chambers run about 400 to 600 beats per minute. So what we do in this procedure is we get inside your heart, and then by using heat energy, a radiofrequency ablation catheter using heat energy, we burn that tissue, and thereby we can eliminate these abnormal, irregular, rapid electrical impulses that are driving to make your heartbeat go very fast.
Doctors can work on a patient in the lab or perform the same procedure on a patient at another location through streaming technology. It's less invasive for the patient than traditional surgery. It also reduces the physical strain on doctors because doctors can sit using robotic technology and avoid hours of standing during traditional surgery.